Imagine going about your daily life, maybe taking a common pain reliever for that nagging knee, or perhaps a medication your doctor prescribed to keep your blood pressure in check. You're doing what you think is right, managing discomfort or preventing bigger health issues. But what if I told you that a seemingly innocent combination of very common medications, one you might even be taking right now, could be secretly skyrocketing your risk of a stroke? Not by a little bit, but by a shocking 300%. It's a painful reality that many folks over 60 are unknowingly walking into this risk every single day. They trust their medications, as they should. But sometimes the combination of two completely separate, often over the counter. Drugs creates a hidden danger. It's like two good ingredients creating a bad reaction when mixed. The secret isn't in one single bad pill, but in how certain common ones interact. In this video, we're going to pull back the curtain on this specific medication combo, understand why it's so risky, and most importantly, what simple, actionable steps you can take starting today to protect yourself and your brain health. This isn't about fear. It's about empowerment. So, stick with me, because watching to the end will reveal something crucial that might just surprise you and change how you think about your daily medications. So, let's dive right into this critical information. The medication combination we need to talk about, the one that can dramatically increase your stroke risk, involves two very common types of drugs. First, we have non-steroidal anti-inflammatory drugs, or NSAIDs. These are the go-to medications for aches, pains, stiffness, and inflammation. Think ibuprofen, naproxen, or even some prescription strength versions. You likely have them in your medicine cabinet right now. Or you pick them up without a second thought when that headache kicks in, or your arthritis flares up. They're incredibly effective for temporary relief, and many of us rely on them regularly. Now, the second part of this dangerous duo involves medications you might be taking for your heart or blood pressure. Specifically, we're talking about blood pressure medications like ACE inhibitors, such as lisinopril or enalapril, and angiotensin receptor blockers, or ARBs, like losartan or valsartan. We also need to include diuretics, which are often called water pills, prescribed to help your body get rid of excess fluid and lower blood pressure. And here's where it gets even more complex and risky: some blood-thinning medications, also known as anticoagulants, can also be part of a dangerous cocktail with NSAIDs, leading to a different kind of stroke risk, namely hemorrhagic stroke, where bleeding in the brain occurs. The reason this combination is so perilous lies in how these medications interact within your body. Let's break it down simply. NSAIDs, while great for pain, have a side effect of sometimes constricting blood vessels and increasing blood pressure for someone who is already managing high blood pressure with medication. Taking an NSAID can counteract the very thing their blood pressure medication is trying to do. It's like stepping on the gas and the brake at the same time. Your blood pressure medication is working hard to lower your pressure, but the NSAID is quietly nudging it higher, making your heart work harder and potentially negating the protective effects of your prescribed medicine. This can lead to uncontrolled high blood pressure, which is a major risk factor for ischemic stroke, the most common type, where a clot blocks blood flow to the brain. But the risk doesn't stop there, especially when we talk about NSAIDs mixed with blood thinners. Common blood thinners like warfarin, apixaban, or rivaroxaban are prescribed to prevent dangerous blood clots. However, NSAIDs also have a mild blood thinning effect of their own. Combining them can amplify this effect dramatically, making your blood too thin and significantly increasing your risk of internal bleeding, including bleeding in the brain, which is a hemorrhagic stroke. This is incredibly serious, as a bleed in the brain can be devastating and life-threatening. So, the critical takeaway here is that if you're over 60 and taking any medication for high blood pressure or to thin your blood, you absolutely must be cautious and informed about taking any over-the-counter pain relievers, especially NSAIDs. It's not just about what your doctor prescribes. It's about everything you put into your body. Many people don't think to mention their occasional ibuprofen use to their doctor, assuming it's too minor. But that seemingly minor detail could be the missing piece in understanding a potential serious risk. What can you do right now? The first crucial step is to become incredibly diligent about reading the labels of all over-the-counter medications. Look for active ingredients like ibuprofen, naproxen, or diclofenac, and be aware these are NSAIDs. The second, and perhaps most vital, step is to have a complete and honest conversation with your doctor or pharmacist. Bring a list of every single medication you take, including all prescriptions, over-the-counter drugs, supplements, and even herbal remedies. Don't assume anything is too insignificant to mention. Ask directly, are any of these medications interacting with each other in a way that could be harmful to me, especially regarding my blood pressure or stroke risk? They can review your entire medication list and advise you on safer alternatives or adjustments. Understanding this specific interaction is the first powerful step towards safeguarding your health. Now that we've pulled back the curtain on this hidden danger, let's explore more deeply what you can do to manage pain safely and proactively protect your brain. Continuing our journey to better understand and manage this critical health risk, let's really cement why this NSAID and blood pressure, or blood thinner combination is so concerning, especially as we get older. Our bodies change with age. Our kidneys may not filter medications as efficiently, and our blood vessels can become stiffer, making us more susceptible to the effects of medication interactions. When you combine an NSAID with a medication meant to control your blood pressure, it's not just about slightly raising your pressure. It can push it into dangerous zones, significantly increasing the strain on your heart and arteries. This sustained higher pressure puts you at a much greater risk for an ischemic stroke, where a blood clot blocks blood flow to the brain, or even a transient ischemic attack, often called a mini-stroke, which is a serious warning sign. And for those on blood thinners, the enhanced risk of internal bleeding, particularly in the brain, is a very real and devastating possibility. This 300% increased risk isn't just a number. It represents real lives, real families, and real impact. Knowing the risks is one thing, but knowing what to do about it is where true empowerment lies. Beyond just reviewing your medications with your doctor, let's talk about proactive steps you can take. If you frequently rely on NSAIDs for pain, it's worth exploring alternative pain management strategies. For instance, acetaminophen, commonly known as paracetamol in some countries, can often be a safer alternative for pain relief, especially if you have high blood pressure or are on blood thinners. However, even with acetaminophen, it's crucial to stick to the recommended dosage and be mindful of your liver health, especially if you consume alcohol regularly. Always discuss this with your doctor or pharmacist first. Beyond medication, there are many non-pharmacological approaches to managing pain and inflammation that don't carry the same risks. Consider topical pain relief options like creams or gels that can be applied directly to the affected area. Minimizing systemic absorption, heat therapy. Using warm compresses or taking a warm bath can relax tense muscles and soothe joint pain. Conversely, cold therapy with ice packs can reduce swelling and numb pain. Simple physical therapy exercises, gentle stretching, or even a regular gentle walk can significantly improve mobility and reduce chronic pain over time without the need for medication. Many people find relief through complementary therapies like massage, acupuncture, or even mindful meditation, which can help manage pain perception. Think about natural anti-inflammatory foods too. Incorporating foods rich in omega-3 fatty acids, like fatty fish salmon, mackerel, flax seeds, and walnuts, can help reduce inflammation naturally. Turmeric, a spice often used in curry, has powerful anti-inflammatory properties. Adding more fruits and vegetables to your diet, especially colorful ones, provides antioxidants that protect your cells and reduce inflammation throughout your body. These dietary changes can not only help manage pain but also contribute to overall heart health, potentially reducing the need for some medications in the long run. Another crucial aspect of protecting yourself is recognizing the signs of a stroke. Time is brain, and knowing what to look for can save a life, perhaps even your own. Remember the acronym FAST-F for face drooping. Does one side of the face droop or feel numb? Ask the person to smile. Is the smile uneven? A for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? As for speech difficulty, is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence. T. For time to call emergency services if someone shows any of these symptoms, even if the symptoms go away. Call 911 or your local emergency number immediately. Don't wait. Don't guess. Regular checkups are more important than ever. When you visit your doctor, be prepared. Have a clear list of all your health conditions, your family medical history, and again, every single medication and supplement you take. Don't be afraid to ask questions. Your doctor is your partner in health. Ask them if there are any known interactions between your medications, particularly regarding stroke risk. Inquire about whether any of your medications could be adjusted or if there are non-pharmacological ways to manage your conditions. This proactive approach turns you into an active participant in your own care, rather than just a passive recipient. By understanding the risks, exploring alternatives, and staying vigilant about stroke signs, you're taking powerful steps to safeguard your brain and live a healthier, fuller life. Next, we'll dive into how these insights can lead to broader, life-enhancing health habits. We've covered a lot of ground today, peeling back the layers on a medication interaction that, for those of us over 60, carries a startling 300% increased risk of stroke. We talked about the quiet danger of combining common NSAIDs like ibuprofen or naproxen with certain blood pressure medications or blood thinners. It's a critical piece of information that truly can be life-changing, and knowing it empowers you to protect your most precious asset, your brain, and your overall health. We explored how NSAIDs can undermine your blood pressure medication's effectiveness or dangerously thin your blood, leading to different but equally serious types of stroke. And we discussed the importance of being meticulous about every single thing you put into your body, not just prescriptions. But understanding the risk is just the first step. The real power comes from the actionable steps we've discussed. It's about having those open, honest conversations with your doctor and pharmacist, ensuring they have a complete picture of your medication regimen. It's about being an active participant in your healthcare, asking informed questions, and not being afraid to seek clarification. Remember, your healthcare team is there to help you navigate these complexities. Beyond medication management, we delved into practical, everyday strategies that can help you manage pain and inflammation without relying solely on NSAIDs. From exploring alternatives like acetaminophen and topical pain relievers to embracing the healing power of heat and cold therapy, gentle movement, and complementary practices like massage. And let's not forget the incredible impact of diet, incorporating omega-3 rich foods, turmeric, and an abundance of colorful fruits and vegetables can be a delicious way to naturally reduce inflammation and support your heart and brain health. These aren't just minor adjustments. They are powerful tools in your health arsenal, helping to reduce your reliance on medications that might carry hidden risks. Most importantly, we emphasized the vital importance of knowing the signs of a stroke, remembering the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. Being able to recognize these symptoms quickly can make all the difference in the world for stroke outcomes. It's knowledge that equips you to act decisively, not just for yourself, but for your loved ones too. So, as we wrap up, I want to reassure you, this isn't meant to scare you, but to inform and empower you. You have the power to make informed choices that profoundly impact your well-being. Remember, small, consistent changes, rooted in awareness and good communication with your healthcare providers, can make an enormous difference in your health and happiness as you navigate your 60s and beyond. It's about optimizing your health, not just managing illness. It's about building a robust foundation for a vibrant future. Every decision you make about your health, no matter how small it seems, contributes to the bigger picture of your well-being. I truly hope this conversation has been helpful for you. Your insights and experiences are incredibly valuable. So please, share your thoughts or any questions you might have in the comments section below. Have you encountered similar medication concerns? What strategies have worked for you in managing pain safely? Your shared wisdom could help someone else in our community. If you found this video informative and empowering, please give it a thumbs up. That tells us we're providing content that truly matters to you. And if you haven't already, consider subscribing to our channel. We're dedicated to bringing you more practical, science-backed insights and tips to help you live your best life at every age, confidently and joyfully. Thank you for joining me today. And remember, with knowledge and proactive steps, you can live your best life at every age.